That always makes it difficult. Okay, so we're going to continue where we left off yesterday. Hopefully we remember some of these different respiratory pathologies. But we're going to start with tuberculosis, which is, I'm going to stand up. Pretty common one. You might have heard it, but not know what it meant or what it was. It's an infectious bacterial disease, usually attacks our lungs, can affect other parts of your body, most commonly occurs in individuals that have compromised immune systems. So like if they have AIDS or some other sort of disease or something, cancer, they're going to be more susceptible to getting tuberculosis. Healthy individuals can carry latent TB without showing symptoms. Here's some of those symptoms: pleuritis, or inflammation of your pleura, cough lasting more than 3 weeks, hemoptysis, always gets me, chills, fever, or night sweats. This is a good little video down here. It's only like 2 minutes long if you want to go back and watch it, on the history of tuberculosis. I'm kind of a history nerd, strangely, and so stuff like that kind of interests me. I can't stand up there. It's just too awkward. I know, it's too weird for me. I know, I was trying to switch it up, but I just can't do it. This is my spot. Anyways, so now I want you to kind of turn and talk to a neighbor or whatever. But talk about the difference in, we talked yesterday about pneumoconiosis. You'll have to remember these without cheating. No, I'm just kidding. You looked like you were like clicking back. Pneumoconiosis, anthracosis, asbestosis, silicosis, and tuberculosis. So maybe try and remember, then if you can't remember between the two of you, you can look it up. So give us something different maybe that you didn't talk about yesterday.
Tuberculosis. That's all I saw.
Asbestosis is caused by asbestos.
Yes.
Silicosis is the silicon dust. Is that the little stuff in the packets?
No, I think that's silica. And I don't know if it's the same. I don't think it's the same. You can look it up and see. I don't think so though.
That's black lung. And then the other one is fibrous lung tissues caused by dust.
Well, good job.
Think we got him? Maybe? Okay. So, what is pneumoconiosis? Somebody tell me that. Lily? Anybody got it? Go ahead, David. Dust. Dust. Okay, so how do you get that? Like, who typically would be? Mowers. Okay.
Quarry people?
Quarry people?
They're the ones like working in the quarry. Is that the one that we were talking about?
Mm-hmm.
Okay. Just making sure.
You go all the way back and frame.
Thank you.
Don't cheat. Oh, there we go. So any sort of dust, like maybe they're a house cleaner and they don't wear a mask. They're constantly around some sort of dust. Trying to think, carpenters, they have a lot of dust that gets kicked up from wood and everything. The next one was what was it? Asbestos?
It was anthracosis.
Anthracosis. Okay, what's anthracosis?
Black lung.
Black lung. So it's also known as coal miners' pneumoconiosis. Looks pretty disgusting. You on the next slide? Then the next one was asbestosis.
Asbestos.
Caused by asbestos. That one would not be good, huh? Silicosis. Silica dust. So who gets this one?
That's the quarry people.
Yeah.
Dadgummit.
Ceramics, glassworks, or sandblasting. Anybody do those sorts of tasks?
No.
Like working with ceramics?
No.
Tuberculosis. We just talked about this one. What's tuberculosis? Yeah, it's just bacterial disease. So I encourage you to watch that whole video. It was interesting. Pneumonia. Anybody ever had pneumonia before? Pretty common one. Pneumonia is serious inflammation of the lungs where your alveoli and your air passages are filled with pus. This most commonly is caused by an infection and often follows cold, flu, chronic illness, or if you're on immunosuppressants. Pretty common to get pneumonia if you maybe have after COVID, or maybe you have an upper respiratory infection. If it gets more severe, it could turn into pneumonia. Causes, as many as 30 causes of pneumonia have been identified. The most common agents are caused by bacteria, fungi, viruses, inhaled liquids, or air pollution. Talk a little bit about some of those. The bacterial pneumonia is most commonly caused by Streptococcus pneumonia. Pneumococcal pneumonia is the only form of pneumonia that can be prevented through vaccinations. So it's the only one that you can get a vaccine for. Bronchopneumonia is localized in the airway, and lobar pneumonia affects larger areas of the lungs, often one or more lobes. So lobar sounds like lobes. You see that? Aspiration pneumonia is when you have a foreign substance that's inhaled into the lungs, like vomit, stomach acid, food, or saliva. Usually there's like a wet cough sound when they're coughing. You can kind of hear that kind of achy, wet cough sound. Gross. You had to cough when I said that. It was necessary. Nosocomial pneumonia is when you contract pneumonia while staying in the hospital. Patients' immune defenses are impaired is typically why they catch pneumonia. And patients are on a respirator, I think that means respirator, not respiratory. Anyways, are at high risk of contracting pneumonia. I'll have to go back and fix that. Walking pneumonia, a lot of times you might have heard this term, maybe your grandma's like says it or something, but it's also known as mycoplasma pneumonia. It's a milder form but longer lasting form of bacterial pneumonia. The patient is not bedridden when they have walking pneumonia. That's kind of why it's called walking pneumonia. You can walk around, do normal things, you're not contained to a bed. But symptoms are a lot more mild than regular pneumonia. So it'll last longer, but it's not as severe. Pneumocystis pneumonia is an opportunistic infection. It's caused by a pathogen that does not normally produce illness in healthy humans. So this is what would mostly affect those who have are immunosuppressed. They might have some sort of disease or cancer or something like that. This is typically caused by yeast-like fungus. Viral pneumonia is caused by different viruses. It accounts for approximately a third of all pneumonia cases. Viruses such as the flu and RSV can turn into viral pneumonia. All right, lung cancer. Lung cancer is the leading cause of cancer deaths in the U.S. Cancer cells form in tissues of the lung. Risk factors would include smoking and inhaling other irritants. Maybe if you work in an environment where there's a lot of, kind of like we talked about with those others, dust or just a lot of things that you might inhale. Maybe you work in some sort of factory that can irritate your lungs. You could possibly get lung cancer as well. Cystic fibrosis. This one was made pretty popular with the movie. What's the movie that just happened? Something like that, yeah. 5 feet apart. Was there another one?
Clouds.
Yeah, clouds. That one.
It's.
Oh, it's
Oh, wait, no,
so sad.
that's not cystic fibrosis.
He had cancer.
He had cancer.
I've seen The Fault in Our Stars.
The Fault in Our Stars.
Yeah, that's the one I was
My
thinking.
girlfriend made me watch that one.
Yeah. So it's a life-threatening genetic disorder where your lungs and pancreas are clogged with large amounts of abnormally thick mucus. This results in damage to your lungs, poor growth, and nutritional deficiencies. And it's one you don't want. Be pretty devastating. Okay, now we're going to talk about different breathing disorders. Eupnea is easy or normal breathing. It's a baseline for judging if you have a breathing disorder or not. Apnea is temporary absence of spontaneous respiration. It's a common respiratory problem in premature infants. Bradypnea is abnormally slow rate of respiration. Brady we know means slow, and you have usually less than 10 breaths per minute. Tachypnea means abnormally fast rate of respiration, and you typically have more than 20 breaths per minute. Dyspnea is difficult or labored breathing. This is typically when you have shortness of breath. It's dyspnea. Hyperventilation is an abnormally rapid rate of deep respiration, usually associated with anxiety, or if you're maybe having a panic attack or something like that. Decrease in levels of carbon dioxide in your blood are a result of hyperventilation. Hyperpnea means commonly associated with exertion, and it's deeper and more rapid breathing at rest. Can occur at high altitude or is caused by anemia or sepsis. Hypopnea is shallow or slow respiration. So which one, you've probably heard of apnea being, I probably should add this on there, being associated with sleep as well. Does anybody have parent or maybe you have sleep apnea where you just have, what did you say? Yeah, you have to wear a sleep machine that gives you oxygen while you sleep. Yeah, it looks quite uncomfortable.
He always,
Wow.
But yeah, wow.
he's a
But
troll.
I'm sure it makes a difference in your
It's
sleep.
a lot quieter. They made a new one now and it's a lot quieter.
Yeah.
My dad, he's just like a troll on Facebook, and he hooked Elijah up to that machine and like posted a picture on Facebook and said like, "Prayers for my little guy, like he's not doing so good." And a bunch of people like comment on it, like, "What's wrong? What's wrong?"
Oh gosh.
Yeah, my grandparents like called my mom and stuff. It was bad.
Trolling. Yeah. So maybe you'll think of that one because that's just where they have irregular breathing while they sleep, so they require a machine. Chaney-Stokes respirations are irregular pattern of breathing where you have alternating rapid or shallow respiration followed by slower respiration or an absence of respiration. Dyspnea followed by apnea, in other words. Commonly noted in dying patients, so when they're about to pass away, you'll notice these Chaney-Stokes respirations. Sleep-related breathing disorders, again, we just talked about sleep apnea, but disruptions of normal breathing patterns that occur only during sleep. It's associated with higher risk of cardiovascular disease and strokes. Different types, of course, sleep apnea, like we just talked about, and snoring. So where your breathing repeatedly stops and starts during sleep, you have a measurable decrease in blood oxygen levels. Obstructive sleep apnea, where the muscles at the back of your throat relax and narrow the airways. Snoring, anybody snoring? I've got a minute. Can be a symptom of sleep apnea if you have noisy breathing that's caused by the vibration like the sleep apnea. Coughing. Expectoration is the act of coughing up or spitting out bodily fluid like mucus, phlegm, stuff. Hemoptysis is expectoration of blood or blood-stained sputum. It's derived from lung or bronchial tubes, and it's a result of pulmonary or bronchial hemorrhage. Anyone ever choked before? It's terrifying, isn't it?
Miss Flippo had to do the Heimlich on me.
Really?
Fourth grade.
I miss that one so much.
That's scary. Like, I feel like it would be the scariest thing. An airway obstruction is commonly known as choking when you have food or foreign object partially or completely blocks the airway and prevents lung from entering or leaving your lungs. It is a life-threatening emergency. You do the Heimlich maneuver to try and dislodge it or get behind the patient and push up. If for some reason they lose consciousness, you would start doing some sort of chest compressions to help get that. Anoxia is the absence of oxygen from the body's tissues and organs. It occurs even though there is adequate blood flow, and they have irreversible brain damage that occurs within 4 to 6 minutes. So if you don't get oxygen to their brain within 4 to 6 minutes, they'll have brain damage. Hypoxia is the deficient oxygen levels in body's tissues and organs. This is less severe, caused by a variety of factors like head trauma, carbon monoxide poisoning, or suffocation. Hypoxemia, you have a condition of having low oxygen levels in the blood, usually due to respiratory disorders or heat conditions. Asphyxia, there's loss of consciousness that occurs when the body cannot get enough oxygen it needs to function. This can be caused by choking, suffocation, drowning, carbon monoxide poisoning. Asphyxiation means the process of suffocating. So if you're being suffocated, asphyxiation. Hopefully we already know this one. It's coming back. Cyanosis is the loose discoloration of skin and mucous membranes caused by a lack of oxygen in our blood. Respiratory failure is the level of oxygen in the blood is dangerously low. Hypoxemia. When the level of carbon dioxide is dangerously high, that means hypercapnia. It's obviously a medical emergency, so if someone's, not able to get enough oxygen to their brain or things and you don't know what to do, you need to call 911. Can develop from a chronic condition. Sudden infant death syndrome, this is probably a really sad one, but sudden or unexplainable death of an apparently healthy sleeping infant typically occurs in ages 2 to 6 months. Suspected to be a heart problem or interruption in breathing. This is why it's recommended that infants sleep on their back instead of on face down on their stomach now. But your baby might be completely healthy and you're laying down to sleep or to nap, and then they pass away in their sleep. They don't really know, like it says, they think it could either be a heart problem or maybe it's due to breathing. They're not really sure. So, kind of sad. Okay. Does everybody know what they want to do for their